Hello, everyone. Welcome to the MDH Stroke Program Monthly Education Series. Happy Stroke Awareness Month. This month, we wanted to share with you a special presenter, Chris Kleckner, who will be presenting on part one of a two-part series on healthcare disparities. Next slide, please, Chris. Before we get started, I have a couple of housekeeping announcements to share. This webinar is part of the MDH Stroke Program Monthly Education Series. Stay tuned to your email for a different educational opportunity each month. You can access all of the previously recorded webinars on our MDH YouTube playlist. Your lines have been muted upon entry. Please ask any questions by typing them in the chat or hold them for the closing. If we don't get to your questions today, we will address them up in a follow-up email. Please also feel free to reach out to us directly at any time. Finally, please note that the webinar is being recorded. Next slide. I would like to take another minute to share some tips on how to navigate WebEx meeting features and engage with us. As I mentioned, you can share your questions using the chat feature. To do this, please click on the chat bubble icon, click everyone, and type your question or comment and click enter. Next slide. Upon time for questions at the closing, you can also raise and lower your hand virtually to ask a question. Please also feel free to engage with us throughout the presentation by using the reaction icons. Select the emoji icon bubble as shown on this slide here. We would love to interact with you. Next slide. I have a few program announcements. 2023 is an exciting year for MDH Stroke Program. This marks the 10-year anniversary of the Minnesota Stroke System legislation. Congratulations and thank you for your contributions and participation in the stroke system of care over the last decade. Coinciding with this big anniversary, we have officially kicked off the 4th round of acute stroke ready hospital designation this past month. If you are unsure on when you are up for your designation, please contact Michelle Gray Ansari. The 2023 Hospital and EMS Stroke Quality Improvement Award season is currently open. Please visit our website for more information or contact our team. Please also continue to notify our team of any program contact info changes. Next slide. I'm happy to introduce Chris Kleckner, who will be speaking on what does healthcare disparities mean. Chris, the floor is yours.
Great. Hi, everyone. My name is Chris Kleckner. I'm really excited to be with you today. Even more so, if you know, I am in the living room of one of my good friends in my hometown of McCook, Nebraska. So I am coming to you from McCook. Unfortunately, I had to come back home due to some family, almost kind of sort of, but not really quite emergency. So I'm really excited to be here with you today. And I'm going to be talking about what exactly does healthcare disparities mean? I mean, come on, you know, we hear this word all the time. What does it, you know, and it's kind of a buzzword right now. And maybe for good reason, because we're recognizing that not everybody's on the same playing field when it comes to getting healthcare or being healthy, and let alone being well. And it's interesting when we look at that, I could be sitting at this table with 10 other people, and my access to being healthy and being well is going to be influenced differently than other people that might be at that table. And so that's really what we're talking about today is that how can we have health care and health amongst everybody at the table to be equitable and the same. And I'm going to also talk about a couple other things about that. And so now we got to talk about the objectives. Okay, so of course we need to know what's in it for us. And so first I'm going to spend a little time talking about what exactly is this? You know, what does it mean? And then maybe we can also recognize how it impacts our communities. And I know that we have people from all over the fine state of Minnesota. And then also we can see how it not only impacts, but how can we apply that to maybe, you know, a particular situation that maybe we're in. So the big thing about this is that this is just kind of an introductory to healthcare disparities. And there are a lot of different levels and things. And, you know, some of you may know this already, and some of you, this will be new for you. So if you have any questions, you know, feel free to throw them at me. I would love to help you. The reason I like this is that my background is actually not just in nursing and EMS, as you saw from my title, is that before I was in medicine, I spent a lot of time studying equity, inclusion, anthropology, and a couple other things. But I don't want to talk about me. I want to talk about healthcare disparities. So I want to start off with a little story because, we should always have a little story with when we're doing this. So let's say you got Angie here. Okay, she lives in a small town in Minnesota, maybe about a population of 5,000. She's a widow. She's got some children between the ages of 30 and 17. Works at a local co-op, and she's in shipping and receiving. But unfortunately, like some people in Minnesota, she lost a loved one due to COVID. And as you maybe have read about, some of the healthcare disparities that have come from COVID, in particular, is that she's got a lot of bills. Even though she had insurance, she was underinsured. One of the healthcare disparities that we can talk about, and I'm going to mention in the future, is that oftentimes in rural areas, these folks are underinsured, in particular if they're farmers. Farmers are the least insured population than anywhere else, and because they just don't spend the money on insurance. So you could see why, especially if Angie's husband was a farmer, why they have a lot of bills. She's depressed after the death of her husband. He was her high school sweetheart. And she's having some difficulties, with that stress. She's still got a 17-year-old at home. And that 17-year-old is being rebellious, They've lost a parent. There's their older home, needs repairs, and then there's the stressful work. It's harvest time. So the other thing about her is that she's overweight, about 40 pounds. She doesn't eat well because she doesn't want to really feel like cooking. She's in a small town, so I don't know if, HelloFresh makes it to her home. And then she often just spends time watching television than getting outside of her hometown. So I just also wanted to throw a little fun fact out there for us. If you didn't know the difference, health care is the delivery of health. So now I wanted to just kind of have you think about this for a second. What the heck is health? What is health? What do we do? We're in healthcare, right? We provide health. And I kind of laugh at this because when my kids were little, I would say, so what does mommy do? And then my daughter used to tell people that I made their boo-boos better. That's what I did. That in healthcare, we make people's boo-boos better. And then when they got older, then I would give them the stink mommy eye at them and say, what do you do? What do I do for a living? And they're like, you clean up people and we have to do the dishes because, my kids would always say they wouldn't do the dishes. And I'm like, do you know what I do for a living? Keep people baths all day long. No, we won't talk about that. Okay, next thing though is that we could talk about healthcare, and that's a facility or a system that provides healthcare. So I thought that'd be kind of fun. Let's talk a little bit about a fun fact that hopefully now you're sitting there thinking about this. What exactly is health? And what are we doing when we're providing health care? Because this is where the disparity is. It's not healthcare system in this case, because when we think about healthcare disparities and healthcare systems, a lot of times it's access to it or economic and stuff. But what is actually health? So if you kind of want to take a minute for there, or if you feel like throw it in the chat, maybe some ideas that you have. But if you sit there and think, what is health? And the World Health Organization says health is the state of complete physical, mental, and social well-being. And it's not necessarily, you're not healthy just because you don't have a disease or you're sick. Because there's a lot of people out there that have conditions or diseases or other maladies, but they will tell you that they're healthy. If you don't mind me sharing that, I used to do home health care. And in particular, I work with people who had respiratory problems. And it was interesting how sometimes somebody would answer the door and they would sit down and I would notice their lips were blue from that little walk to let me into their kitchen table. And I would say, how are things going? Oh, I'm going great. This is probably the best I've been feeling in a long time. Because in their perspective of that holistic thought of themselves, they felt good. And even though they had that disease. Well, I also want to jump into wellness because health and wellness tied together. And so wellness, on the other hand, is holistic approach. It's the whole person. And if you remember that slide that I just showed you about health, it's not physical, it's also social and mental. And so again, you got the mental and physical health and being well and promoting wellness. And those of you who are nurses and maybe perhaps have your public health, license, as well as anybody out there from EMS that is working in community paramedic or community EMT, you're familiar with that it's about the disease prevention and how we look at that in terms of wellness. So that wellness is helping people be in that great sense of health. All right. So I want to share with you this model. This comes from Sam's ALSA. I don't know how to say this acronym actually, but this particular model I like better because if you were Googling wellness or health models, there's usually the sixth dimension. But one of the things when we talk about healthcare disparities, two dimensions are not included in those other health and wellness models. And those two are, sorry about that, I'm having little issues with my my computer here, so sorry about that. But some of the big ones is that they don't always include the mental part of it and the social. They don't carry the social, and they also don't technically have the intellectual. And a big thing that's part of this that, we have to sit and think about the economic. I'm trying to spell economic there. Bear with me as I didn't do a very good job. The thing about this is, as I am erasing this, that there's so many different aspects to being healthy and well. So for instance, we kind of look at um, environmental factors, and I apologize. I'm trying to be really cool today, and it's not working so well. I'm not used to working in WebEx, so I apologize. So for instance, let's look at somebody who is trying to be well, and if you live in an urban area where there isn't access to things like a park, or that you would be afraid to walk due to your safety, your wellness is going to be impacted due to your environment because where you're living doesn't give you the opportunity to be healthy and well. Also, along that time, is think about even like you in your own work, or maybe people you worked with, that if people love their job, they tend to come to work and find joy and fulfillment, and they oftentimes will not call in sick as much. They will have greater productivity and other things like that because they enjoy their work and they feel well there. However, I'm sure you can pick people out that you've experienced in your life that don't like their job, that complain to you all the time, and they're always calling in sick. And, so that's somebody who's not well due to their occupational status. Now, for all of those of you who are night workers, though, let's talk about maybe we might love our job, but our occupational dimension of wellness is being affected because we work nights. And I worked nights for 5 years, and finally my provider said, you have to get off nights. It's affecting your wellness because I was always sick. So this is kind of an example, and I'm sure as you sit and look at this model, you can also pick up from yourself, either, examples that what you've experienced, or maybe even within yourself or seen with other people. And it's interesting how all of these things make the complete person and bring in wellness and health if we look at all 8 of these dimensions. On a side note, one thing that I forgot to mention is the spiritual dimension is something that's really being researched. And they found with cancer studies that people who have terminal cancer that have been essentially 6 months to live, that they found that they actually live longer if they have a greater sense of spiritual connection. And it doesn't have to be a Christian or any other type of organized religion, but if they have a strong sense of spirituality, they tend to have longer lives that they feel were satisfactory before they passed away. All right. I apologize. Now I'm going to click forward. I'm driving myself crazy. I apologize. And if I say it, I apologize one more time. I'm sure you're not gonna. There we go. So healthcare disparities is what we're talking about today. And healthcare disparities are preventable issues that we find in healthcare. So, for instance, there are things called racial biases that if somebody walks in the door of a healthcare facility or a clinic and that provider has biases and that bias affects that provider's ability to see the whole person, then that is considered a healthcare disparity and that can be prevented. One of the things that I've been kind of following in research is like healthcare disparities due to obesity. And it's actually very sad that how providers will judge somebody who is obese. And it creates this disparity because that can be prevented. People who are obese are less likely to have pain control. It's interesting that they're most likely to not have their pain treated or will be undertreated based solely on their weight. And it's sad, and that could be prevented. So we're going to talk about some other things along the lines that can be prevented. And then if you join me next month on June 13th, I'm going to be talking about ways that maybe we can stop healthcare disparities or maybe lessen them. So again, healthcare disparities are preventable, and we can do things about that. Now, one of the things that I wanted to talk about with healthcare disparities, they're linked to several different disadvantages that are within society and who we are and where we live and other things like that. And so some of them are social. So I'm going to talk about the social determinants of health, economic, and that makes sense, right? For instance, I'm actually, it was by not coincidence, but I lost a classmate that she died on Monday, and she had cancer, and she was very underinsured, and she did not have the funds to travel outside of my small hometown to get to Denver or Omaha or Lincoln for chemotherapy and specialized cancer care. And I heard that they tried to do a fundraiser in town to try to help with the cost of just transportation because she didn't have the money or a reliable vehicle to get to either Denver, Omaha, or Lincoln because her particular type of cancer was rare and the local community hospital couldn't help her. And then, of course, environmental is something I'm talking about now, too, because I'm in a rural area. And because of this rural area, the local community hospital can only provide certain types of chemo and other things like that. And the care that this classmate of mine needed for her cancer couldn't be provided here. And if you notice this picture here, one of the greater forms of healthcare disparities that we see in Minnesota, that I'm going to talk about here in a minute, is really along racial lines. So this particular model was done by the National Academies of Science, and I just kind of wanted to show this to you, because I like models, and I thought, if you kind of look at this, if you think about all the risk factors that are played when somebody needs health care and whether they seek it like for wellness or prevention or if they need it, it makes sense that, who you are and what kind of relationships you are and what kind of community you live in and other things like that all play a factor on whether or not you can get access, know how to use healthcare, and what the outcomes would be. And another piece that's part of this that I'm not going to spend too much time on today, but is health literacy. And, whether somebody will be compliant with their medication regime or it could be compliant with follow-ups or even understand what they're doing is really tied to health literacy And we all know that health literacy right here is tied to our outcomes. And it's one of the things that, can drive our um, healthcare disparities, because sometimes it's like, for instance, if somebody doesn't speak English as their first language and they don't understand, what they need to do to be healthy, like within some of our populations in Minnesota, I found some data from some counties like McLeod County that they have a lot of healthcare disparities amongst the Hispanic population and diabetes. And one of the things that that county recognized is that, we have this, ethnicity of Hispanic who are perhaps not understanding the health literacy, and so their outcomes are lower, and that's affecting the community in terms of productivity. And so, this model, I think is a great way that we can look at how, you know, we can, if we stop healthcare disparities and look at how they're all intertwined with each other, that maybe we can also make a difference in our communities. Let me talk about healthcare disparities for strokes, because this is being sponsored by the fine folks about strokes. And it's really interesting when you look at some of the data that comes out of Minnesota, and I'm going to kind of talk about it just briefly, that Minnesota is actually one of the healthiest states in the United States. If you really think about it, we really are the center for medicine. Think of all the big powerhouses in medicine that we have in our state, like the Mayo, the University of Minnesota, and so forth and so on. We got, but yet one of our big glaring problems, especially like say for stroke, is that if you're African American or another minority, and in particular Native American or Indigenous, the chance of dying from your stroke is up to 30 to 40%. Wow, that's a big gap. The race that is less likely outside of being white to die from a stroke is Hispanic and or Latino. But especially if you're Native or Indigenous, your likelihood of dying from your stroke is very high. And I think as Minnesotans, when we sit there, we want to be proud of our healthcare, but yet we do have that disparity and more. So let's talk about health equity. So there's a difference between equality and equity. Equality means everybody gets the same, but that doesn't really quite work. And maybe perhaps you've seen that picture where it shows everybody trying to watch a baseball game and they're on the same, steps trying to look over, but the taller person can see and the shorter person cannot. Even though they all got the same step, the shorter person still can't see over the fence to watch the baseball game. And so that's what this is trying to show you, is this idea is that the tall person and the person with the step, they can, reach health. And this, by the way, I got cut off, but this picture is from the CDC Minority Health. But as you can read here, that you can see that health equity is trying to not just get everybody to the same level, but actually to the highest level, that all of us deserve to have great health and wellness. And that's going to require a lot of different things. And some of the biggest things is looking at our society, because that's where the changes have to come, is like, our attitudes and our money, really, is investing our money into different things that where we recognize those healthcare disparities and what can we do about it, and what can we put our funds to create that highest level of health for all. I apologize, I skipped this slide. I apologize. There we go. Okay, there we go. Woohoo! Anyway, so let's talk about some of these factors, though, that are being impacted by health and in our wellness. And so I'm only going to talk about a few of them because of the time. I am going to give you a whole lot of resources at the end of this video, because we know that money makes things go round. But I have some kind of startling statistics that when we think about healthcare disparities, it makes sense that this financial dimension really impacts us. For instance, since 2021, and this is the latest statistic that's out there because, you know, they're always behind about a year or two, so they're doing 2022 right now, is that the average cost for health per person in the United States is almost $13,000. And that is remarkably high um, compared to other years. And yes, there is the factor of COVID, but it's funny because actually it went down in 2020, but then it went back up in 2021. But since in 2021, prescription costs have gone up 5.8%. And they predicted the trajectory, sorry about that, is actually increasing, and they do think that it will be around 6.3%. And then the other thing is that when we look at our out-of-pocket expenses, though, have gone up significantly. It was around in the 6% prior to 2021, and now it's 10.4. And again, the prediction that it is going to be much higher. So it's costing us more to be healthy, and that's partially due to inflation. And you know, healthcare providers are pushing a little bit more onto us. Insurance companies, when they're negotiating with companies, those companies don't want to pay as much, you know, for the health to provide healthcare insurance, so they're raising the deductibles. So those are some of the reasons that these financial, you know, changes have been happening. And again, I only see it going up. And as an industrial nation, we spend so much more of our gross income on healthcare than any other industrial nation. So it's very expensive for us to be sick in the United States. It's also the environmental dimension. And I did put this slide in before I, you know, ended up coming here to Nebraska. But since I've been here, it's really made me think about being in a rural area. And when I was thinking, you know, about like, you know, the case study and everything like that, there's a lot of differences of like where you live. And I wanted just to kind of mention like rural versus urban. For instance, the distance in which you have to travel. So where I'm at is kind of a hub for medicine in this area, and people will travel up to an hour to get healthcare in this area. There's also access to diagnostics and treatment. Um, like I mentioned, that my classmate wasn't able to get adequate care for cancer because she couldn't afford to travel. But on the flip side, like in my hometown, they don't have ERCPs, the ability to do that. So if anybody needed an ERCP, they would have to travel out. Stroke. If somebody has a stroke in my hometown, yes, they will do TPA. I found out they do. But then they have to transfer them out. And one of the interesting things that I found when I was here, as opposed to Minnesota, that I know Minnesota and a lot of communities out there use telemedicine and telehealth, that you can, you know, call up a neurologist at, like, say, Abbott Northwestern, doing a shout out to them, and you will get a neurologist and they will help you in your smaller community, if you're from a small community, you know, make that determination if they get TPA or not. And out here in Nebraska, they're still working on that part of telehealth. So I thought that was kind of interesting. And then that, you know, so sometimes people don't have access to specialists. So one of the things that I know that in Minnesota and other places like that, that specialists are seeing that there is benefit for traveling to like a local community and having specialty clinics that say they only come like for 3 days out of the month, but that's still better than that we had before, and bringing care to people. And another thing though that has helped that healthcare disparities, that if you want to look at the literature that's coming out now about telehealth, it is actually bridging that gap because then specialists are accessible, especially through telemedicine. So I wanted to talk now about that social dimension of medicine and of health, and of wellness. And the social dimension is more along the lines of those social support systems, whether it be with you know, others within your community or your family and other things like that. And one of the things that has been particularly interesting about how much COVID has impacted, and we're still recovering from being isolated, And that dimension of health has been very affected by our ability to have social connection, and that quarantines and isolation and that still are happening, and it impacted our mental health. So one of those aspects, again, of that dimension of wellness was that one of about emotional. And because of our inability to be social, our emotional health is being impacted. And they found that due to the pandemic, 1 in 3% of adults are depressed. Another thing that I don't have on the slide, though, that I wanted to kind of share, and then maybe perhaps you're also thinking about, is how there's this real change in how the family structure is and where people live and the proximity as we change our society and what is work and other things like that. Families are spread across the United States from coast to coast, right? And so even in some of the smaller communities, children are growing up and they're moving to the cities, and so we don't have that social support or support system when our like our children or our parents or anybody else that's in it are moving. And then some of the dynamics with that on health and wellness is also something that has been noted. All right. So part of health and wellness is another thing when we talk about healthcare disparities are called the social determinants of health. And if you kind of heard some of the different things I've been saying, these are also tied to those 8 dimensions of health and wellness. And here are the social determinants of health, which are very closely tied to those health and wellness determinants. So I'm not going to go into these very far, but I'll talk about them more in June. But again, if you think about it, that the economic stability, and within a community in particular, communities that have money are able to help bridge that gap and disparities by putting money towards such things as neighborhoods and parks and other things like that, or economic stability. So if you have a community that is healthy, and this is like one of the impacts of healthcare disparities, but if you have a community that's healthy, people can spend their money on investing into the community rather than into their healthcare, then those folks can then in turn contribute to the city or town or village, or get to like help things get better. So for instance, like parks, that's a big thing. Kids that have access to parks are more likely to play at the parks, and they're more likely to be physically fit, and the obesity rate with those children are lower. Communities that have money and a good tax base, they can take that from the school, referendum or whatever it may be, and they can take that money and build, playground equipment and invest in physical education and nutritional education. And we're going right back to that health literacy, and we can invest into the health literacy when we have economic stability. So those are just some examples of how we can tie these things with our social determinants of health. All right, excuse me for a moment as I erase these and we move on. So let's talk about these healthcare disparities and in terms of our communities. So let's start with this. So there's a huge amount of impact on our communities when we have healthcare disparities. One of them is just, the ethics involved with healthcare disparities, the social, the racial, the justice piece. And some of this is probably dear to some people's heart, a little bit closer to home if you live in the Twin Cities. We went through that time with, with George Floyd's death and some other deaths and the protests and other things like that. And, some of that could be tied to, the healthcare disparities. And unfortunately, because of some of the damage that was done during some of the protests, there became issues within that wellness circle. In particular, the Cub Foods downtown and the Target were both impacted by the protest, and they created a food desert. And so that impacted obviously the wellness of that community, because now there's a food desert because two of the major suppliers of food were not available. And so, so there's an example of like the social justice piece on why we want to bridge healthcare disparities and also see the tie with social justice and healthcare. And the nice thing is that when we invest in our communities and we invest in bridging the gaps in healthcare disparities, we can actually create healthier populations. Makes sense, right? And if our populations are healthier, we don't have an economic burden of healthcare. So a great example is that people have good health and we do preventative care, whether it's primary, like through education and promotion, or investing in the parks, right? Then our tertiary is also going to be involved, and we can do screening and other things like that. And we can stop big, expensive illnesses from happening, like diabetes. If we do that, then our community is healthier, and these people are less likely to use Medicare, Medicaid, and not charity care within our hospitals. So an example is that if you're a stroke coordinator or an EMS and you want to promote healthy lifestyles and start off in that primary prevention and have like wellness fairs and stroke prevention by helping people also screen for high blood pressure or diabetes, of course, then that's less likely that they're going to come to your emergency room uninsured or underinsured with a major stroke that's going to require a great amount of rehab and rehabilitation. And if it ends up being charity care, if you think about it, that's a huge economic burden on your community, especially if you have a community-based hospital or your hospital in general for the for the charity care that you may have paid. And of course, the decreased use of emergency room. People who have health care disparities or don't some of the things are lacking within their healthcare wheel, that if you think about it, that if they are not getting prevention or understand about healthcare, they end up in the emergency room. And oftentimes when they're in the emergency room, they're really sick. Obviously, then, if we got healthy communities, and they're going to be more productive. And one of the interesting things is that the University of Buffalo, they have an Institute for Research on healthcare disparities within the community. They found that the healthier their community is, it actually decreases their taxes because there's not that economic burden. So I wanted to just kind of mention to you about how much it costs us here in Minnesota. So Blue Cross Blue Shield in Minnesota, it's kind of interesting, and they, as well as health partners, I do a lot of research in Minnesota. Obviously, they want to save money because they're a health insurance company, but some of the data that they find is really fascinating. And that, if we decrease healthcare disparities, we save ourselves a lot of money. And I apologize, I didn't realize until that I did a little bit of a boo-boo that this got cut off, but these are in the millions of dollars, that we're saving ourselves millions of dollars if we close those gaps. So again, we're the healthiest state, but we have great disparities in our races between Caucasians, whites, and our other ethnicities and races in the state. So I was thinking that I could just kind of close out and then kind of maybe stir your brain a little bit from listening to me yammer here, is that if you remember Angie and you think about her wellness, can you think about what was influencing her health and her wellness? So, but unfortunately, Angie's story changes. She wakes up one day, can't move her arm and a leg. She's rushed to the community hospital, and of course, she has a thrombolytic stroke. She declines to be transferred out of the community because she's worried about her children, in particular that rebellious child. and she decides to do a rehab and stroke in the local area. So if you think about that, if we look at like that wellness wheel again, I'm sure we can, and if you want to throw in the chat, so I'm not the only one, is that, but if you think about what she's decided to do, what dimensions would most impact her based on where she lives? Okay, and that's okay. I know that we've got a lot of people probably in line too. But we can also think about, what dimensions will impact her current family structure, and then what dimensions can impact her financial situation. So there's a lot, that we could think about, so for instance, if she didn't have a good spiritual health before this or wellness, that may be really impacted because why me? Why did this happen? Another thing, obviously, with her financial situation, she's already in debt. Now she may have lost her ability to work, and she's 55. And so, she wasn't anywhere close to retiring. Her physical is going to be obviously greatly impacted. And will she have the support that she needs in her care? Because, she has 2 grown children and the 17-year-old. And that 17-year-old is not too happy right now. So those are some of the things that we could be thinking about. So I'm going to ask if there's any questions, and I'm just going to let you know that there's a lot of references that are part of this, and that it'll be, I believe, available. And on behalf of the Minnesota Department of Health Stroke Program, I need to remind you to click on the link in the chat, and if you have any questions, I would love to answer them.
Thank you so much, Chris, for your wonderful introduction to healthcare disparities. If anybody has any questions, please feel free to unmute your line or type the questions into the chat box. We'll just give it a minute here for some questions. While we're given that minute, if anybody has a question, please, like I said, feel free to unmute. But until then, as Chris mentioned, she'll continue this discussion on Tuesday, June 13th at noon. She will present the topic, what can we do about healthcare disparities, excuse me. And so look for that invite this afternoon. That will go out this afternoon for the webinar. It'll be a Tuesday, so please note that in your calendars. It's not going to be Wednesday. It'll be a Tuesday presentation. Any questions? Remember to click on the chat bubble to view your chat box if you need help accessing that. Otherwise, upon completion of the survey link has been placed in the chat box there. You can click on the survey and complete your 1 hour of contact hours for today after completing the survey. If you're watching this video on our YouTube replay, please expand the description box and click on that survey link to access your contact hour as well. Thank you again, Chris. We'll give 1 more minute here for questions. All right. Seeing none, I think we'll call this one a day. Thank you again, Chris, so much for your presentation. We are really looking forward to your presentation next month. And happy Stroke Awareness Month to everyone, and thank you for everything you do, and we'll see you back next month in June.